Flare-ups and setbacks. Flare-ups in back pain are very common. Sometimes you know exactly what might trigger or lead to a flare-up, but other times there is no particular reason for a flare-up, and this can be extremely frustrating, but it's actually quite normal. This final topic will discuss what we learned from flare-ups and setbacks, and what tools we can use to manage our symptoms in the longer term. Looking at our back pain journey, so in an ideal world, management of your back pain, or any joint pain actually for that matter, would look like the top image, a steady progression with no hiccups and no flare-ups towards the finish line. So that's in an ideal world. Unfortunately, it is rare that management of back pain is as straightforward. In reality, it's more like the image underneath, full of ups and downs, pitfalls and challenges, step forwards and step backs, but ultimately heading in the right direction. How you manage a flare-up is important. What you will do will make a difference to how often you have a flare-up, how long it lasts, and how severe it is at the time. Always try to look to prevent a flare-up where possible by planning and pacing your activities. So these were strategies that we learned in previous sessions. Another way to prevent a flare-up might be to look at ways to identify any stress in your life and looking at ways of controlling stress levels, and also looking at ways to be, despite the pain, becoming physically active gradually and trying to keep that activity level up. Important here to remember that an increase in pain is rarely a sign of injury or ongoing harm. You're sore, but you're safe. Like flare-ups, setbacks are normal, and it's unusual that things go smoothly all the time. Setbacks could be looked at in a constructive way, as they can give you greater understanding of your symptoms and enable you to practice some of the skills that you have learned on this program. Perhaps even the skills you've learned on this program can help you to become your own physiotherapist as you learn best how to cope with and manage your symptoms as you move forward. Everyone is different in how they manage flare-ups and setbacks. What works for one person may not work for another. Again, this is perfectly normal, as we don't have a clear recipe as to how we can manage back pain, but we definitely know that it takes a little bit of trial and error to figure out what works best, and this will be very individual. On this slide, we have listed a number of potential coping strategies. These are things that won't necessarily make the pain disappear, but are things that will help you to manage your symptoms when you're going through a flare-up or if you are experiencing a setback. Examples of some coping strategies that we've explored previously on this program are gentle exercise or gentle physical activity, using active rest, using ice or heat, using the technique we've come across previously called pacing, which is breaking the task down into small chunks and then gradually building back up over time, using pain medication or pain relief, the use of breathing exercises, relaxation techniques, the use of TENS or acupuncture or massage, the use of friends and family for support, particularly if you have set a goal that you'd like to achieve, and making sure you're using your family and friends to help you achieve that goal by making them aware that you're working towards something. Trying to maintain a positive outlook, try not to panic and to stay positive. The use of mindfulness and also the use of visualizations have been tools that can be useful. I like the image on this slide as it shows an optimistic graph about back pain. Maybe when you started this program, pain was the central thing on your mind, or maybe in your life at that time. And so like this graph, it shows pain placed right in the center. But then as the program has gone on, maybe you have picked up a couple of skills or tools, such as understanding pain or understanding your symptoms. Okay, so once we understand something, it actually can reduce the threat around something and reduce the fear. So then we start maybe to start moving again, or know that it's safe to do more things. And once we start moving, we start to get a bit stronger and we start to feel more in control of our symptoms. And as that continues, we become less scared and less fearful. We start continuing on this path of movement, therefore building up our endurance, building up our self-confidence, and then definitely moving towards returning to our normal activities. And then hopefully, as the cycle continues on the spiral outwards, we then start to hopefully return to normal day-to-day things with a reduction in our pain. And I think one of the aims of our back pain program is to provide you with the skills, and that includes understanding your pain so that you feel empowered by your new knowledge to manage your symptoms independently. The way we think about pain is very important. The research shows that if you understand your pain more, then you can feel more in control, make better decisions, and experience less pain in the longer term. Key points to take away from this session. Don't panic. Remember, setbacks and flare-ups are normal. Learn from these experiences. Use a setback or a flare-up to help you recognize if another is about to occur, and to recognize tools or strategies that you could start implementing to help. Go back to basics. Consider any techniques or strategies that you found useful in the past, or any techniques you've gained from this program, and try to use those when you're experiencing a setback or a flare-up. Remember your gains. Look back at how far you've come, and remember that gains can't be taken away, even if it feels like they've been lost forever. Remember to reward yourself and to remember the progress that you've made. Keep going. Even if you can't solve the problem straight away, don't give up. Setbacks and flare-ups are normal, and you will get past it. Thank you for taking part in our program. We hope that you have gained some useful tools and skills to help manage your back pain in the longer term.